welcome to the Pharmacy Podcast Show. You are listening to the first and only podcast dedicated to the business of pharmacy. Be sure to subscribe to the show via iTunes and leave us a voice comment from our contact section on the website. You can find all of our episodes at pharmacypodcast.com.
Hello, this is Louie Foster with Integra, and you're listening to the Pharmacy Podcast Network.
Hey, welcome to the Pharmacy Podcast Show. This is Todd Uri, founder of the Pharmacy Podcast Network. You know, I've been in the pharmacy sector, pharmacy technology for some time now, and one of really starting out in long-term care pharmacy specifically, and then kind of growing out through that with different technologies has been the Integra LTC Solutions team. And really, they're known as the DocuTrack guys, but this organization has really transformed into so much more than that. We are going to do some podcasting with Integra LTC Solutions, who are incredible sponsors of the Pharmacy Podcast Network. It is going to be based around technology. We're going to have a historical show coming out about Integra LTC Solutions' historical aspect, but today is more about something very specific that the team's very passionate about. We're going to be talking about secure messaging in long-term care, and I am very honored to have Mr. Louie Foster, who's been part of the Integra team for quite some time. Mr. Louie, welcome to the Pharmacy Podcast Network. How are you?
Well, I'm doing excellent, and thanks for having me, Todd.
You're very welcome. So, like I said, I've been a fan of the organization, and even more specifically you, back when I was actually in pharmacy technology, representing a pharmacy management system. You and I did some work together with several of our customers in tandem and putting DocuTrack together with their pharmacy system. It was pretty exciting stuff, and the APIs that work between the two systems. And I tell you what, you guys have come a long way, and today I'm pretty excited to talk about something that is continuing to be an evolutionary product and evolving and giving our customers, long-term care pharmacies and institutional pharmacies, a leg up. And so let's talk about secure messaging in long-term care. You know, we hear a lot of terms thrown around. I just got back from the HIMSS 2017 conference, which was in Orlando, Florida, just this past February, and I heard terms like HIE, obviously HL7, Direct Connect, Secure Messaging. Before I get into some of my questions and get started, can you break that down for us, specifically Secure Messaging in long-term care?
Yeah, absolutely. You know, it's interesting, the number of acronyms we have in technology.
That's right.
Tends to be excessive, and then you add healthcare on top of it. And anytime I bring in an engineer, you know, we joke that it takes weeks for them to just come up to speed so they can communicate. But what we also have is in direct and secure messaging, we have a whole bunch of new terms that some people might be familiar with because some of them, I would say, are outcroppings of meaningful use. So the HIE really is the Health Information Exchange. And the HIEs in technology store the centralized healthcare record. Generally, they're set up at the state level. And then the other important term when it comes to secure messaging is also HISP. HISP is a healthcare information service provider. When we start talking about direct is really a way to send secure messages between providers, and the HISPs are the ones who provide that capability. So if you kind of look at it, it's similar to the telephone company. The telephone company gives you the ability to send and receive calls. The HISPs give you the ability to send and receive secure messages. And then on top of it all, you have a health information exchange, which can make use of information coming across in those secure messages so that it can tie that information to a centralized health record for the patient.
That makes sense. What I've seen evolve, and I like the analogy, Louie, about the phone systems and the phone companies, because you, back in the day, and I'm sure some of our listeners might remember this, others probably don't, the Bells per se, Bell Atlantic, and all of these central offices had basically the wires, and they were the ones that transported the actual physical voice calls. But then we started coming out with what was now known, of course, as long distance. I don't even think we say that anymore, being that mobile phone has taken over. And that transference was so expensive and so tedious. And by the way, my grandma worked for Sprint back in the day. It was called United Telephone Company, and she physically made call switches at the switchboard that people wanted to dial out of Butler, Pennsylvania, and they'd ask the operator to connect them somewhere else. So that's amazing to see how technology has really transformed. So now that we kind of understand secure messaging from the infancy of where it came from, how do you intend for it to work with DocuTrack specifically? Because that's really been the bread and butter initially of what Integra LTC Solutions was, but now you're transforming into so much more as an organization that's a technology expert. So do you plan to build your own solution?
Well, we plan to essentially, I would say, direct secure message enable our DocuTrack clients. What that ultimately means is that instead of sending that fax out over the Ma Bell telephone network, they can send all these documents, communications, messages, even structured information like patient RX information and RX history. They can send it all out through DocuTrack. It's going to go up to the HISP, and then from the HISP, it'll get down to the pharmacy's client, whether it's the facility or potentially the physician that is servicing the patient, or even messages going to and from the payers. What that allows us to do is we can focus on the integration piece of direct into pharmacy rather than getting into a business that a lot of people are already doing and doing quite well, which is providing that interconnect that the HISPs are providing, much like the telephone company. So we don't want to reinvent that wheel. We just want to make it accessible to long-term care pharmacy, which, interestingly, when we were out there discussing integrating DocuTrack with direct secure messaging, we talked to a number of HISPs, and none of them even realized that long-term care pharmacies existed. And they were even shocked to find out that institutional pharmacy even had fax machines. So I really had to spend a lot of time educating them and bringing them up to speed on the market, just so that we could have a productive conversation about how to integrate. And out of talking with many of them, we ran across one provider in particular, and that provider not only understood long-term care, but was actively working with long-term care pharmacies, the EHR application in use by the facilities, and wanting to bring direct across the board. And so we were able to bridge that gap. And essentially when direct releases, the nurse in the EHR application, she's not going to have to print something and walk it over to the fax machine to send it to the pharmacy. She's going to be able to hit a button and it's instantly going to show up at the pharmacy. There's going to be no loss in data, guaranteed delivery, and there's even going to be things like delivery receipts and read receipts. Imagine, being able to send something, not only knowing that Nurse Betty got that allergy alert, but that she opened it and consumed the information. So, it not only streamlines that communication away from fax, but it also brings a lot more clarity into who's consuming the data at the other end.
We're going to break this podcast into two pieces and talk with your partner and really kind of vet out some of the ideas that you have and what you've talked about so that our listeners really understand it. because if we sat here and talked, you and I could talk for hours and hours about this sort of stuff, but really being respectful to the listener in the car or jogging, or most of our listeners are commuting, just going to try to keep it to two parts. So if you're listening, we're going to have a follow-up, and you'll be able to listen to the completion of this concept and idea, which will be really exciting in kind of rounding out what is secure messaging and how this affects the business of long-term care and institutional pharmacy. What would you say to the listeners? What are you trying to solve ultimately?
I would say if we could boil all of our products and solutions and even the future stuff that we're working on that we're going to talk about, really the problem that we are solving for the pharmacies is we are giving them the ability to manage their work in the most efficient manner, regardless of how that work comes into the pharmacy or what that work is. You know, it could be a new order coming in or a prior authorization being received. It might be that the hood in the clean room has dropped pressure and somebody needs to follow up with a technician. All that work, regardless, can be managed in one spot within the pharmacy, and that's what we've focused our solutions on doing. The moment you get work that's divided across technology platforms, I've got work in the pharmacy system, I've got work in content management, I've got work that's to-do lists, sticky notes on my computer screen. You can't manage that work across those platforms until you consolidate it all in one spot. And that's what we're doing.
When I'm listening to you talk, in my mind, I can see these areas that are specific to be addressed in order to make a new workflow repeatable, regardless of the section of the pharmacy or the workflow that you're in. So let's talk about areas that need to be addressed, and the areas that you help to address to bring solutions to.
Yeah, and I think one of those areas is secure communication. You know, as we look out over the marketplace, we are increasingly seeing pharmacies move and be dragged to a technology state where they can provide secure communications to, their clients. The days of wanting to pick up a telephone and talk to the nurse are going away quickly. So things like secure text messaging are coming in to help fill that gap. And secure email as a communication platform is coming in to help fill that communication gap. The number of secure emails I get from clients has, I would say, quadrupled just in the last year. And unfortunately, I'm dealing with multiple individual clients, and they each have their own secure email platform. So I have to keep an entire list of passwords and logons just to access these emails being sent, all of which are time consuming. I even had a situation where a client sent me a secure email. It was about 2 weeks ago, and I clicked on the link to follow through. I brought up my password book and found the logon. Well, unfortunately, it had been a while since I logged in, so I had to change my password. So I had to go through that, and it wouldn't just allow me to get in once my password was changed. I had to respond to an email sent to my regular email address and then click a link. So I clicked the link. It wasn't nice enough to actually click the link and then log me in. I had to re-log in with the new password. And by the time I went through all that, I got in, and there was no mail in my inbox.
Oh my gosh.
So I called up the client and I said, whatever's in there that is regulated data, remove it and just talk to me now. Or send it to me. So
I thought you were going to say you finally logged in and the message said, "Hi, Louie." And that was it.
Oh. With that client, I would not have doubted it. And he might be listening, and he knows who he is.
That's funny. So obviously workflow comes to mind, transition of different duties that need to be done by each individual person. But what about the data? Talk to me about mounds and mounds of data. Like, how are you guys helping to manage and make it easier for these pharmacies and operators to do business?
Well, and that's where I think direct secure messaging is the next frontier. And direct secure messaging, it was a technology that was born in acute care. And, the side of the healthcare market that forgets that we exist. But by and large, it's a technology that allows providers to send data to other providers that aren't in their network. Traditionally, that was being done via fax. It might have been courier services. But with direct secure messaging, a patient could go to a hospital, have a hip replacement surgery. From there, they might move to a longer-term facility for 2 to 3 weeks while they heal. And direct secure messaging allows that hospital information system to send the discharge notice electronically over the public internet in a HIPAA-compliant manner to the facility that will be admitting the patient. And there's lots of great things that can happen at that point. That message can contain, all the diagnosis, the patient's medical history, and it can contain all the documentation that needs to go to the admitting facility, all within that one message. So if the facility is using an EHR application, much of the data entry's already been done. They can pull the information directly from that secure message to help during the admission process, and all the supporting documentation that they need can be sent along with that message. So gone are the days of faxing it over or stapling it to the bottom of the gurney as the patient leaves the acute care facility, or using a courier service. Not only does this technology facilitate that communication, but it also delivers things such as read receipts, delivery receipts. So the discharging facility knows without a doubt that the admitting facility actually received the message that was sent. And when I started looking at this technology, I was quite surprised to find out that there are over 1.2 million addresses. And these addresses are much like an email address, but they're being used by providers across the United States of America. They estimate that over 55,000 providers have a direct secure address already. And so, scratching my head, I had to sit back and go, well, why haven't we been looking at this in LTC? And it turns out a lot of people have been, but it's been, on the longer term care facility side, where they might have point-click care or Achieve Matrix, receiving those direct secure messages from the discharging hospital. Who's been forgotten in the mix is the long-term care and institutional pharmacies servicing those long-term care facilities.
What makes me think of the hub of all of this and how a institutional pharmacy becomes compensated is many times, and I guess I could say unfortunately many times, it boils down to the government's reimbursement at the federal or state levels. And I think of CMS. So what steps has CMS done to try to address the needs of the institutional pharmacy? And I think of technology, and I don't think that CMS is innovative, but I know they're paying attention to much of the back-end processes and and the way to manage payments. So just give us a description of how that rolls back into the world of technology in Integra Group.
Well, and that's something that CMS set up, realizing that they might not be the most technologically innovative organization. They set up funding with the 90/10 so that technology providers could apply for that to bring technology like this into healthcare. And so at the state level, it's something we could approach in Washington State, being where we're based. We could approach and offset some of our development costs with funding like that. It's also funding that is accessible to the pharmacies to implement technologies like this. So this wasn't born in a vacuum, so to speak. It was born with the full focus that things like direct secure messaging, HL7 Direct, work together to facilitate communication between providers, but it's also something that can work in conjunction with health information exchanges. So as these messages are sent between providers, exchanges can start pulling these messages and tying the healthcare information being sent between providers with the centralized health record for that patient.
So when I'm listening, I'm a pharmacy technology IT director. I own my own pharmacy. I'm starting a pharmacy, or I just want to upgrade technology, improve workflow. I'm listening to the show. Lights are starting to go off in my head, thinking, "Wow, But what are the next steps? If you were to talk to a pharmacy director, operations director, what steps should pharmacies be taking to engage?
Well, and that would be talking with their clients, their payers, and their physicians that are servicing their patients. Many of these may already have secure messaging in place via direct. That 1.2 million addresses are going somewhere. And about a year into this, and we talk to pharmacies on a day-to-day basis. I was talking to a pharmacy in Illinois last week, a fairly large pharmacy, and the moment I mentioned HL7 Direct Secure Messaging, they instantly lit up because a number of their physicians have been asking them to stop using fax, but to start using direct as a way of sending these forms and communications to the physician itself.
That's refreshing.
So, yeah, and if you look at the secure messaging, while I would say it was kind of born with the concept to facilitate transitions of patient care, it's being used above and beyond that. It's really so simple in a lot of aspects that, if a physician has a direct secure address, then they can hook up Microsoft Outlook, and connect to what they call a HISP, Healthcare Information Service Provider. And so any direct messages coming to that address can be downloaded securely in Outlook, and he can respond just like he would with email. And they're sent up to the HISP and then back down to the other provider. So it can be and is starting to be used as a way to secure email without having the headaches and hassles of the generalized secure email services. And because the HISPs themselves control the network, getting that HIPAA regulated data, or PHI, outside of the network is not a possibility.
Excellent. So if I'm listening to the show and I have questions that have now come up in my mind. If you do have those questions, I want you to reach out to this team. They really have saturated and been a part of the transformation of pharmacy technology and institutional long-term care pharmacy space. Louie, you've been there since, as far back as I can remember, even the name DocuTrack and Integra Group. Wanted to thank you guys for committing to a series. We're going to be interviewing part of the Integra team, maybe some of your customers, in an upcoming other pharmacy podcasts. And Louie, it's been exciting to talk with you, enlightening, and bringing back some old memories of working with you directly.
Absolutely. It's been my pleasure as well.
So you're listening to the Pharmacy Podcast. We were on with Louie Foster. He is product director with the Integra Group. You can find them at integragroup.com. That's INTEGRA group.com. Or better yet, just Google Integra LTC Pharmacy. It'll come right up. And we thank you so much for listening to the Pharmacy Podcast Network.
We hope you enjoyed another episode of the Pharmacy Podcast Show. Be sure to subscribe to the show and send us a voice message with your ideas and comments from our contact section on the website. Did you know we develop digital health content to assist with business development and marketing efforts? Learn how we can help you drive more patients, physicians, and targeted leads to your website. Contact us today at pharmacypodcast.com.